Okay, I'm going to take a look at our analysis essay prompt. So the first thing we're going to do is just read the prompt. Analyze the dichotomy healthcare providers encounter when they treat their culturally diverse patients. Through our reading, we have seen the cultural barriers and language barriers that Peggy Philp and Neil Ernst experienced with the Lee family while caring for Leah Lee. Explain how healthcare providers can balance their contradictory roles of honoring their patients' cultural practices and beliefs and upholding their Hippocratic oath to do no harm. Okay, the next thing I'm going to do is look up the words that I'm not sure what they mean. So I'm going to take a look at analyze. Analyze is to study or determine the nature and relationship of the parts of something by analysis. Okay, so I know I'm going to have to study or determine the nature of the relationship of the parts through analyzing. All right. Then dichotomy. What does dichotomy mean? Dichotomy is a division into two especially mutually exclusive or contradictory groups or entities. Okay, so it's the process of or practice of making such a division, something with seemingly contradictory qualities. Okay, so it's something that's contradicting with something else. All right, and then explain. Explain is to make known, to make plain or understandable. All right, that makes sense. Contradictory, we know, looked at that just a minute ago. So it's the opposite or denial of something. All right. And then lastly, I'm not sure about the Hippocratic Oath. So the Hippocratic Oath is an oath embodying a code of medical ethics, usually taken by those about to begin medical practice. It has to do something with being ethical. Okay, so let's go back. So analyze, so I'm going to have to really study and take a deeper look at the dichotomy, so the contradiction that healthcare providers encounter when they treat their culturally diverse patients. So there's some type of contradiction that they face. Through our reading, we have seen the cultural barriers and languages that Peggy Philp and Neil Ernst experienced with the Lee family while caring for Leah Lee. Explain how healthcare providers can balance their contradictory roles. Okay, so this is the contradiction of honoring their patients' cultural practices and beliefs and upholding the Hippocratic Oath to do no harm. All right, so I'd like to just pull out the verbs on one side and then what am I supposed to do? So I know that analyze is a verb, so I know I'm going to have to analyze the dichotomy healthcare providers encounter when they treat their culturally diverse patients. Okay, so I need to analyze the dichotomy healthcare providers encounter when they treat their culturally diverse patients, and I need to explain. Okay, I need to explain how healthcare providers can balance their contradictory roles of honoring their patients' cultural practices and beliefs. Get all that? And upholding their Hippocratic oath to do no harm. So first I need to analyze just the contradiction that healthcare providers encounter when they treat their culturally diverse patients. Because as we've learned and we've read about, some patients have different beliefs other than what we may believe in Western medicine. So, for example, they may not want to have certain tests performed or have surgery because they would be cut. So that's a problem when they want to make sure that they uphold their Hippocratic oath to do no harm. So that's where the dichotomy comes in, that division, that contradiction, where they need to honor their culturally diverse patients and their beliefs. But then they also need to make sure that their patients are well and that they get better. So that's where I will need to work on explaining that, on how they can balance this contradiction to honor their patients' cultural practices and beliefs, while also at the same time making sure that they are ethical in their treatment to make sure that no harm comes to their patients. So again, for myself, just breaking down, I like to look at the verbs, pulling them out, and then putting to the right, kind of like a checklist for myself, what I need to do. I like to read through. If there are any words that I don't understand, I will look them up. And again, the conflict is healthcare providers treating their culturally diverse patients and making sure that they provide the best medical care. That would get back to the Hippocratic Oath over here, to make sure that no harm comes to their patients. So that's what I'm going to analyze, just that conflict that any healthcare providers face when they come across just different beliefs and customs, and making sure that they're providing the best care for their patients. I'm going to explain how healthcare providers might be able to balance that dichotomy to both honor their patients who have different customs and traditions, beliefs, while also making sure that their patients receive the best care. So that is how I broke down the essay prompt. I am interested to learn how you approach the prompt to break it down, to make sure that you are doing everything that's asked on the prompt.